Welcome to This Explainer. Today, we're diving into the fascinating and absolutely critical world of hepatobiliary diseases. You can think of this system as your body's ultimate multitasker, handling everything from digesting your food to detoxifying your blood. But when this vital machinery breaks down, the consequences are severe. Let's trace the clinical journey of how this system works, how it fails, and what we can actually do about it.
To kick things off, let's look at a pretty staggering piece of epidemiology: 10 to 15%. That is the percentage of adults globally affected by gallstones alone. Just let that sink in. If you look around a crowded room, a huge chunk of those people are literally walking around carrying little stones of cholesterol or pigment right under their liver. And that is just one piece of the hepatobiliary puzzle. These diseases are a major cause of global morbidity and mortality.
Here's our clinical journey for today's explainer. We'll quickly cover the basics, causes, and risks before moving into pathology and presentation. From there, we'll look at investigation and diagnosis, explore management strategies, discuss complications and prognosis, and then wrap the whole thing up with prevention.
Okay, Section 1, Basics, Causes, and Risks. Let's get our foundation built. So, the hepatobiliary system isn't just a single organ, it's a really intricate collaborative network. We're talking about the liver, your largest internal organ, right? Synthesizing proteins and detoxifying drugs. Then you've got the biliary tree and the gallbladder. It's basically an essential plumbing system that stores and transports bile straight into your gut to digest fats. When diseases hit here, they severely disrupt that flow, completely compromising your body's ability to detoxify itself.
Now, what's truly fascinating here is the incredibly diverse etiology or root causes of these diseases. It is definitely not a one-size-fits-all attacker. We are looking at infectious agents like viral hepatitis or liver flukes, metabolic issues like non-alcoholic fatty liver disease, physical obstructions like those gallstones we mentioned, and toxic causes from alcohol or drugs that directly physically injure the tissue.
Building directly on those causes, certain risk factors will drastically increase the odds of developing these issues. And while viral hepatitis is a massive global driver, everyday lifestyle plays a huge role here. Obesity, high-fat diets, diabetes, these are major contributors to metabolic liver diseases and gallstone formation. Throw in chronic alcohol use or a genetic predisposition, and the risk multiplies.
Moving right along to Section 2, Pathology and Presentation. Let's actually look at how this disease progression looks and feels in a patient.
The pathophysiology here relies on this crucial, almost inevitable domino effect. It starts with initial cellular injury, maybe from a virus or a toxin, which triggers inflammation. If that inflammation persists, the liver starts laying down collagen. That leads to fibrosis or scarring. Over time, this scarring gets so severe it completely distorts the liver's architecture into this tough, maze-like state we call cirrhosis. And because blood struggles so hard to push through that scarred maze, it knocks over our final domino, portal hypertension.
But what if the initial problem isn't cellular injury, but a physical blockage? When gallstones block the cystic or common bile ducts, bile literally has nowhere to go. It can't escape. This backed up bile accumulates within the liver, a condition known as cholestasis. And let me tell you, bile is highly caustic. When it just sits there stagnant in the liver, it wreaks total havoc, causing secondary cellular damage to the hepatocytes. So how does this clinical presentation actually look when a patient walks into the clinic? Well, the warning signs are pretty distinct. Right upper quadrant pain and profound fatigue are often the very first hits. If bile is backing up, we'll see jaundice, that classic yellowing of the skin and eyes, alongside dark urine, pale stools, and severely itchy skin, or pruritus. As that portal hypertension we talked about worsens, you start seeing physical signs like a fluid-filled abdomen, called Ascites, an enlarged liver or spleen, and even spider angiomas. In severe cases, patients get brain fog from toxin buildup, which is known as hepatic encephalopathy.
Of course, in differential diagnosis, clinicians really have to play detective to separate true hepatobiliary issues from mimics. For instance, right upper quadrant pain might be a gallstone, for sure, but it could also be a peptic ulcer, a pancreatic issue, or, surprisingly, even right-sided pneumonia referring pain downwards. You really have to look at the whole clinical picture, like the presence of jaundice or dark urine, to hit the nail on the head.
All right, Section 3, Investigation and Diagnosis. Once we suspect it, how do we actually identify the problem?
This breaks down the investigative toolkit perfectly into three main areas. First up, lab tests. Elevated liver enzymes like ALT and AST act as red flags for cellular damage, while alkaline phosphatase and bilirubin specifically point to blockages.
Next, we have imaging studies. Ultrasounds are fantastic for spotting gallstones, while an MRCP non-invasively maps out the entire biliary tree. Finally, direct intervention. Doctors can use an ERCP to physically look inside the ducts or grab a liver biopsy to assess the actual microscopic scarring.
That brings us to Section 4, Management. Let's explore the medical and surgical solutions we have.
Usually, doctors start with targeted medical therapies, heavily depending on the exact cause. If it's viral hepatitis, they'll deploy antiviral drugs. For a cholestatic disease where bile just isn't flowing, ursodeoxycholic acid can be a real game changer. Managing cirrhosis complications requires a highly tailored approach, like using diuretics to drain off that excess abdominal fluid, and giving lactulose, a specialized sugar, to quite literally draw toxic ammonia right out of the blood. And if there's a stubborn physical stone in the way, they can go in endoscopically to remove it or place a stent.
However, sometimes pills and endoscopes just aren't enough. For persistent symptomatic gallstone disease, a cholecystectomy, which is the surgical removal of the gallbladder, is incredibly common and highly effective. If there are tumors involved, surgical resection of the liver is necessary. But for end-stage cirrhosis or complete liver failure, where the organ is just no longer functioning, the definitive, ultimate life-saving surgical option is a full liver transplantation.
Section 5. Complications and Prognosis. This is where we really need to understand the high stakes involved.
We absolutely cannot underestimate these diseases because the complications are where things turn life-threatening fast. Remember that portal hypertension we discussed? It forces blood to bypass the liver through smaller, super-fragile collateral veins in the esophagus and stomach. These varices can easily rupture, leading to catastrophic internal bleeding. Plus, chronic liver disease drastically ramps up the risk of hepatocellular carcinoma, or liver cancer. And if a gallstone completely blocks the common bile duct, it can trigger acute pancreatitis, or worse, ascending cholangitis, which is a deadly biliary sepsis.
When it comes to prognosis, this quote really hits it on the head. Timing is literally everything. If caught early, before permanent scarring sets in, the liver has this almost miraculous capacity to heal and regenerate itself. Early disease generally has a solid prognosis, but once a patient progresses to advanced cirrhosis and frank liver failure, the mortality rates absolutely skyrocket. Without a transplant, it is a very narrow window.
Finally, Section 6, Prevention. Let's talk about how to protect your health.
Public health interventions combined with personal lifestyle choices are unequivocally your best shield here. Getting vaccinated against hepatitis is a massive, easy win. On a broader scale, safe blood transfusion practices are crucial for preventing viral transmission. But on a personal, day-to-day level, limiting alcohol consumption and maintaining a healthy body weight directly prevent both toxic and metabolic liver injuries. Oh, and if you know you have gallstones, screening and early treatment prevent those terrifying infectious complications down the road.